Now, for years, we've been told to stay out of the sun because of the risk of developing skin cancer. But now some scientists are claiming that the health benefits of sunlight may outweigh the risk. Researchers say sunlight helps reduce blood pressure, cutting the risk of heart attack and stroke, and even helping you live longer. Joining me now is Dr. Richard Weller. He's a senior lecturer in dermatology at Edinburgh University who carried out the research. And a very good afternoon, or good evening, I should say, to you. So how do the health benefits of sunbathing outweigh the risks?
Well, that's speculative. I mean, I would start off by saying that we know very solidly that excess sunlight is the major preventable risk factor for skin cancer, and that data remains very solid. But there is a good side to sunlight. The question is how good and what's that risk-benefit ratio between the good and the bad. I mean, vitamin D made by sunlight is well understood, but what we've shown is there's another mechanism by which sunlight may produce beneficial effects. We've shown that there's big stores of a substance called nitric oxide in the skin, and the sunlight moves that into the bloodstream, where it dilates blood vessels and produces a small fall in blood pressure.
OK, so there are some medical benefits. The problem is, for many, many years now, we've been told to stay out of the sun because of skin cancer, which is the most common form of cancer in this country. Are you at risk of confusing people here?
I am not advocating rushing out, throwing away sunblock, removing hats, going out and getting too much sun. I mean, this is early research. And what we've shown is we've exposed people to sunlight and shown after a 20-minute exposure to sun ultraviolet lamps, there is a temporary fall in blood pressure. That is not enough by itself to produce a reduction in heart disease and stroke, which falls in blood pressure too. But it does suggest that we should move on to other studies, looking at whether we can take advantage of these findings, perhaps giving daily UV and seeing if that will produce a long-term fall in blood pressure. Because a long-term fall in blood pressure, a sustained fall, would be expected to lead to reductions in stroke in particular, and also heart disease.
So where's the balance then? I mean, what is your advice to people watching? Do they go out in the sun, as maybe that you say to do because it helps with blood pressure, or do they stay inside or cover up, as the likes of skin cancer research tell us, because of the problems of melanoma? It's very confusing, isn't it?
Sure. There's at present, no change in advice on sun behaviour. Don't get sunburnt. Children in particular should be careful of sun, not excessive sun exposure. I mean, what this research shows is that there is a new mechanism by which sunlight may benefit general health, but it's not yet confirmed. I suppose it's leading us towards more research studies and to try and work out that balance.
Just briefly, do you sunbathe?
No. I don't sunbathe. I would just get bored, I think. But I wear a hat in the sun. I wear sunblock. But I don't restrict myself.
We'll leave it there. Thank you very much for joining us tonight.
Thank you.